Assalamu alaikum doctor. Today our topic is cancer larynx. So let's start with cancer larynx. Cancer larynx is one of common cancer of our body. It constitutes almost 2.60% of all body cancer in India. Then who are mostly affected, men or women? Men are mostly affected. Do you know why? Because of smoking and alcohol consumption. So age group is mostly between 40 to 70 years of age. Etiology we told that tobacco and alcohol consumption. So another one is occupational exposure, which includes asbestos or any kind of chemical products. Then genetic factors has also some contribution. Here comes the classification of cancer larynx. We classify laryngeal cancer based on the site. It may be supraglottic, glottic or subglottic. Supraglottic region includes our epiglottis, then our arytenoid, epiglottic fold and false chord. Here we can see a diagram, and this is the false chord and this is our true chord. So till false chord is our supraglottic region. Here comes the true chord and anterior and posterior commissure. It forms our glottic region. Below this is our subglottic region. Histopathology. Before knowing the histopathology, let's recall the lining epithelium of larynx. We know that most of the larynx are covered by the ciliated columnar epithelium, except two portions. That's the vocal cord and upper part of vestibule. Our vocal cord and upper part of vestibule is covered by squamous cell epithelium. Interestingly, our cancer is most oftenly occurred here. So 90 to 95% of the laryngeal cancer is basically squamous cell carcinoma. Now we'll know about each of the cancer. Supraglottic cancer mostly spread locally and involves our vallecula, tongue and piriform. So it involves our vallecula, tongue and piriform. Nodal involvement is early, and our symptom mostly it is silent in the early stage. In later stage it may develop throat pain, dysphagia or referred pain in our ear. Then the later symptom involves weight loss. Weight loss is common for almost all cancer. So weight loss and respiratory obstruction. So next comes our glottic cancer. It also spreads locally, and most of the cancer is glottic cancer. Then symptom involves the early sign of glottic cancer is hoarseness, and that's why we can detect glottic cancer early, which is good for a good prognosis. Then in late cases there may be stridor and laryngeal obstruction. So most importantly we have to remember hoarseness. Then comes our subglottic cancer. Subglottic cancer can spread downward into trachea, and symptom includes stridor and laryngeal obstruction. Their worseness occurs as a late symptom. For the diagnosis, the first thing is taking history of symptoms. Interesting thing is, any patient in this cancer age group, means 40 to 70 years of age people, having persistent or gradually increasing hoarseness for 3 weeks, we must check for the larynx cancer. Then comes indirect laryngoscopy, then flexible fiber optic laryngoscopy. Then we examine the neck to see any extralaryngeal spread. Then we do radiology. Radiology involves chest X-ray, also soft tissue neck lateral view to see the extent of lesion. Then CT and MRI. Then we do microlaryngoscopy for better visualization of small lesions. To confirm, we do supravital stain with biopsy. Then we go for the treatment. Treatment, we know for any kind of cancer patient, the treatment would be radiotherapy, chemotherapy and surgery. Here the treatment is also same. So the first is radiotherapy for T1 and T2 stage. Then surgery. It may be conservative surgery or total laryngectomy. Then total laryngectomy we do in case of T3 and T4 stage, or if there is any failure after radiotherapy or conservative surgery. We try to avoid laryngectomy in fact. Then combined therapy. It includes surgery and radiotherapy. We do pre and post operative radiotherapy. Then endoscopic carbon dioxide laser excision, and we try for organ preservation by chemotherapy followed by radiation. Chemotherapy followed by radiation. Or we give a concurrent chemoradiation. So this was for today, and the book reference is Dhingra. And if you really like the video, please subscribe and please give a thumbs up and encourage me and ask me for any kind of video that you want. Thank you.